Turning and turning in the widening jar, the falcon cannot hear the falconer. Things fall apart, the center cannot hold. But this time the center is going to hold because we are achieving excellence in customer care. Amanfo, yɛtoa so. Let's start off with patient satisfaction. We've been talking about patients getting satisfied with our services. But what is patient satisfaction in the first place? So patient satisfaction is the extent to which patients are happy with our health care, both inside and outside of the doctor's office. So most of the time when we talk about patient satisfaction, we are skewed towards what happens in the consulting room when the patient is sitting in front of the doctor. So again, like we said, it starts right from the gate. Time a patient in the hospital in the gate, the experience starts from there up until the time they leave. The satisfaction covers all these areas. So let's cast our minds back. When you look at the word hospital, it comes from a Latin word which actually stands for guest or host. So when you look at the true spirit of hospitality, that is supposed to be at the core of our hospital experience. It's like a guest who has gone to a hotel. You want a treat. You want to have that serenity. So when you look at the theology of the word hospital, it looks like it's supposed to be a great guest experience or the true meaning of hospitality. And so years past in the rock ages, hospital was seen as a place of solace. That was a safe haven. Even in times of war, when wars broke out, the combatants will attack any facility in a country or a town. But when they get to a hospital, they go past it because they realize that that is a place where people go and get healing. And so they don't attack hospitals. So in the true spirit of the word hospital, that is how the hospital experience is supposed to be like. When I was in a patient bar and come from all the chaos, from all the stress now we'll go through now. We'll be hospital environment now. They expect that serenity. They are supposed to get that hospitality. So I experience no munya or baby and hospital and also munya so experience no. But what do we see now? There is a problem. And the problem at stake is that now patients or people see the hospital as a scary place. Say obi yarea, they will go through every means possible, say no outside the hospital. And it's a chemical shop be no beko no be near drew be no no for 2 days be no betona, then they can avoid the hospital. And so in an ideal situation, the hospital should be the first point of call before the situation gets worse. But because the hospital has become a scary place in the patients feel say they should try any other means. Now the hospital should be the last resort. All because as health workers, we are making the hospital environment a scary place for the patient. Now there is a model called the Canon model. According to this model, every patient has some basic set of subconscious. Rural hospital, there are some expectations, but they are subconscious. And so those expectations are so routine and so expected. Say the patient will be shocked at the end of the day if those expectations are not met or those things are absent. For instance, physician now here no, that physician's competence. If the competence is absent, that patient will be shocked. That's why I got another doctor and you know what you do no prescriptions and you do baby no patient will be so patient. And they are matric be condition. Okay, we the try here. That takes away all the trust and the confidence from the patient. My patient need feel say, hey, me na doctor didn't be guinea pig here. I be try her say, e be here and I say ye. As a doctor now, crowd we need me. Subconsciously, every patient expects say, doctor now or him no should know everything about the condition. No? And so they will be shocked if this is absent. If I feel no about doubt physician no competence. It takes a lot away. And no class psychologically, the therapy that the patient is about to undergo, no, other things, access to the health facility, the facility should be readily accessible. The waiting time, again and again we've talked about this. Say patient biara now should be a certain institution to go and access service. Nobody expects to spend the whole day there. And so it's the same way for the patient. Patient na expect say the day ni nyina oba be spend in hospital they expect say within the shortest possible time they should be able to access the health service and be able to leave. Saa nneɛma wei nyinaa, this canon model is saying say the satisfaction of the patient increases as more of these expectations are met. And indeed, the competence of the physician who say, oh, people will need the that alone, the waiting time is met. Scheduling, how I schedule or we ufi how you say, if all these things are expectations are met, then it increases the satisfaction of the patient to a very large extent. Let's recognize that the patient has got certain rights. Yes, there is the patient charter, and we know that this charter spells out the rights and responsibilities of the patient. As much as the patient has some responsibilities when they come to the health facility, like taking good care of the hospital facilities, like showing respect to we the health workers and other patients, they have certain rights. And into gone are the days patient beba hospital. Now maame nurse and now doctor ohwe no obi bi say na maame nurse and doctor within the same. And gone are the days the health worker can open your mouth and tell the patient say eno hu hia eno mfa ho ka onu tum na menye de meye. No, those days are gone. The patient's charter is enforced. The patient has the right to know who the health worker or the person taking care of him or her is. We know that the patient has the right to refuse a certain medical procedure or intervention. And it is a negotiation. Also, the patient can. Even though you are doing everything that is in the interest of the patient, you need to seek their consent. Now, there are factors influencing patient satisfaction. There are individual differences, one of the main factors. As part of understanding a patient's expectations, let's understand that there are individual differences. There's a difference between the older patients and the millennial patients. The older patients have certain expectations. And inti mate opanyi bi a waka say, ene the doctor, me call doctor ho anhwe me yie kra. All because these patients came for a review. And doctor na anhwe ni yie because the doctor only asked certain questions and made notes. In previous encounters, oba doctor ebe stethoscope, no dey ato ne kokoso, no dey ato ne chi, no wa check you tie ni mu. So this time around, oba ya doctor ntie ni mu no, and the doctor anhwe me kra. That is the expectation of the older folks. Millennial patients also have their own expectations. Ono benya kra bi kra nka won fa nsanka no, odi wani hwe na watch drama no. There are individual differences and we need to understand that. Our communication, I mean, there's a big difference between waiting to be seen and knowing why you are waiting. Say about hospital, near your sunlight, when you are waiting like that, my time no 1 month. But if we get some information, at least the one nurse be bano be kache say abusuafo pancho munya botre e behwe mu nyina doctor na ohwe mu no emergency bi aba. See any rushing kufu be in a mokonya accident. And it's your fair doctor for more hanging so biam number bois, near service uncle phone, and into me now, and check Romby, you know, my back on pay a bit to. When the patients who are in the queue know this, I mean, it saves us a lot. They know the reason why they are waiting. They know that, hey, if you an anchor, men are make accident in one, and come in so me per doctor and be to me come me. Ninti nya botreni and train on muku save lives no, or move your baby to us. But almost one of many information biana, all that they know is that they are in the queue. No one is attending to us. Now the tia command crying say and social media bay. Now whilst they are waiting, who say nurse for now or more train because the doctor is not there, of course the nurses will have to wait now. Maybe a nurse is no move or move phone so was happy. So to the innocent patients, the only man say any buy no be fee. And a nurse for no corner control or motive move phone soon no more. And command or more bon or more seriously, and no more jay say more fire. So we need to be mindful of this. And then our care coordination. The patient wants to see that we as health workers we are working as a team. And yes, or the prescription could do pharmacy na pharmacist na hwɛ na doctor yi so de bɛn na watwe sa doctor yi so de ya hwɛ ni you obekum nkrofo hospital how no. The patients don't want to hear and see that. They want to see that we are working as a team. And it is a prescription that we do pharmacy. Now, pharmacists who say there is a mistake on the prescription. Nothing should stop us from working as a team. Say pharmacists no be go backstage. One for phone, a friend doctor say, oh, some milligrams here now those we are true. The M say broso and anything can be beside the prescription. But no correct my patients now, so that the doctor can provide an explanation to why he gave that dosage, whether it's actually a true mistake or he knows what he's going about. But right in front of the patient, condemning one another, that is not what the patient expects from us. So there are ways that we can assess this patient satisfaction. In the health service, there are some methods that we employ and we would like to encourage us to continue with those things. For instance, the patient satisfaction survey that we do on a yearly basis. So yearly, we go back to our patients and assess through a survey how they see our services. We need to ask them information about our communication, whether we are doing the right thing for them, the cleanliness of our environment, our responsiveness, so that they also share their responses with us. Once they give us those responses, we can do better. Of course, we employ the method of using suggestion boxes. In most of our facilities, unfortunately, our suggestion boxes have been closed for years. But some patients go through the pain of dropping suggestions for us. We need to turn our attention to those boxes, go into them and see what our patients are reporting to us so that we can also act on them. Of course, we set up complaint desks and we need to make sure we have the right caliber of people manning those desks so that the patients can feel comfortable, come to the complaint desk, give out their complaints, and we work on them. These days, we've added the open day forum. This is where we open our doors. We open our doors to all our patients. In an open day, all the health staff, we come and sit down. Then we invite the patients and we face to face. They should come and tell us right to our face the things that we are doing wrong. It's also important that we continue to champion this so that we get the right feedback from our patients. Now, service excellence. And you're promote service excellence. We need to break the ice, make eye contact, smile. Patients know bano. Fani say you wa ubusuani. Hey, auntie akusia. And then you want to make the nya bro. If you abusunya pa na odi just outside. Hey, and then say that you want to talk crab mana bro so. Those are some of the connections we need to make with our patients. No feel say, hey, me so me health worker. I'm power dream home. Sometimes we even go through the extent of picking the phone to even call them, find out how they are doing. Hey, until Kusia, and then the neck wasn't bow review no, and so you who were and then of course, then they know that there are people who really care about them. As part of service excellence, we need to break the ice when they come. Let's make eye contact. Let's call them by their names. Let me enjoy more kai to say as one the one can you. Let's show courtesy. Kind and polite words. These are what will make the patient comfortable. Patients near comfortable, they will share everything about their health status with you. One thing about patients is patients lie about their health status, especially if it's a gynecological situation there. Definitely, most of the time, we'll be doing intro. Baby son say only be Malaysia, or catch yourself on a virgin, and so if you're breaking the virginity crowd, no, be 13 years. But when we make them comfortable, they will tell us what it is that is wrong with them. They will not lie to us. Let's inform and explain things to them, and we'll promote a lot of compliance. People are less anxious when they know what's happening, and into my patients need feel at ease. Anxiety never come. There are some patients who come and sit in front of us. We check the blood pressure. Then 160, baby 160 over 100, 160 over 120, 190 over 100. Some of them is just because of anxiety. BP apparatus na machine. Some of them is about how you treat you. The way my nurse no when you close you know who cry the machine. Into your bet now on a come pim. And into BP no rise. But here kwako start your command BP draw. Our bro here BP draw. So we need to make sure that we let them feel at ease. See the whole person. Patients now, we always need to look beyond their illness and see the whole person. Some of the patients that we interact with, some of them are people of high repute. A lot of people that we interact with now in the society, they are big people. Maybe they see any rushing about hospital. So let's see beyond the person sitting in front of us. See the whole person. Ebiana or chinebi and mobi ohian, Sandy Pano to no pet and obey my ass adenamo. And we need to always acknowledge the patients as such. Let's pay undivided attention to them. And then again, like we said, social media, any new mentee, we are doing a whole lot of things in front of the patient. If you are crowd call up, can see patients need tea and no when you call. Hey, Sandra, me say no wedding now, one man party, oh, missy you, J. Share, so now say, hey, Joycelyn, or no wedding gown, no, maybe because we need petite here. But number share, gown be your lunch or, hey, Jayo, no, me say, what should I do? All this while the patient is sitting in front of us. Among four. So let's make sure that if you need to make a call in front of the patient, it should be related to the care that we are extending. If you have any personal call to make, upon you make your call. Or in the worst case scenario, at least let's sort the consent of the patient. Mama call with the or send me if I then you excuse yourself. Let's preserve the dignity of the patient. Let's secure their confidentiality and privacy. It's also important. We need to watch what we say, where you are saying it, and to whom you are saying it. And your point, you want to throw now, only a colleague, motive to Mukufi, I feel that discussions I can say. Hey, Akusia, Nana Mammy, who you kruno. Hey, Mammy, so dear. Yes, what ye chi here and so, marketing anymore. Inside the trotona among 14, you are discussing this patient who baby or tea a juma or BBR, and you're also discussing the patient's condition as well. We need to be mindful of what we are saying, where we are saying it, and to whom we are saying it. Patient confidentiality is very, very important. And discussing patients now outside the consulting room, and I will be taken care of now. If you need to discuss anything with a colleague, it should be the time now patients into one eye and you want further information. Outside that, we don't need to discuss the patient's information anywhere. And we need to preserve their dignity, treat them with respect and a lot of modesty. And always remember that the patient has a family. On any family now, whatever we are doing, most of the time the family become anxious whilst they are waiting. Not we can no more interrupt it, no more, but because they want to know what is going on. So as time goes on, let's take time to update the family too and let them know, reassure them most importantly, let them know what is going on. Doctor-patient interacting, and then patient education as well. Typically, before patients now, when you can Google the chronic or reading about some of the symptoms now or experience, what the possible health conditions are all facing. So let's take our time to clear their doubts, and we need to be patient about it. And yet, titibim na patient betre when you catch you say doctor me feel as malaria, I'll say any sorry so what diagnose you no. We need to be patient with them because of course everyone is reading wide and our patients are also reading. There's a lot of information on the internet, so they can easily go on the internet and then try and do a quick search of whatever they are going through, have an idea and then alleviate some of their anxiety. Let's learn something from Disney. Disney has a customer approach that we need to learn. If we're able to take a cue from them, we'll be able to always improve on our patient or our customer satisfaction. We know Disney. Every year, millions of people travel across the world to go and visit Disney and then also be part of their customer experience. And one thing that we know is that they are client-centered. All the Disney employees, all the senior leaders, including the CEO, and they make sure they give the customer an experience of a lifetime. And if you call her, there is a probability that you want to go back there because of the way they treat you. How do they do that? 5 simple ways. And every year, millions of people visit them. Number one, they understand their guests. That is one. That is the foundation of their treat. They want to give you a great experience, but first they understand you. They try and then know your needs, what you expect. Once they know that, the second thing that they do is that in Disney, everyone is a performer. So we know that Disney is into production, but at the end of the day, every Disney employee is a cast. So they hear movies or TV, so everywhere we appreciate it now. They make sure that at their workplace, everybody, even though we have the actual cast, but every employee there, from the cashier to the custodian to the greeter, obia a performing. And how do they do this performance? Simple. It is not a complicated performance. They tell every staff that all you need to do is be friendly and attentive. So once we have guests, all you need to do as a performer, just be friendly and be attentive, and that's all. And anyone you interact with on their premises, I mean, you'll be excited, you'll be captivated, because they are all performing. All that they are doing is that they are being friendly and they are being attentive. So the third step is that they seek out interactions. Every Disney cast member go out of their way to actively engage and interact with their customers. And to trust you me, when you are on the premises of Disney, now you go walking on the park, maybe I'll got ice cream, no? Probably is the CEO who is selling that ice cream. Or no, be share the free in the office, about be jinaho at the park just to interact with customers. And that person that you are interacting with, maybe I will give you some information be over here. It may be a senior management member at Disney, but they all come down to everyone's level. So we be our share shorts in Bini Bibi no general interacting with everybody. We be say CEO in Jina. That's how they act with their customers. The fourth thing that they do is that they own the guest. So before you set out foot out of their park or onto their park, they get all your information. Or how they will be sending you reminders and all that, just so that you know that these people really care about me. They've taken the pain to know the schedule that I came here with. And they are sending you reminders. Okay, about this time you planned to go out to walk in the park, you plan to visit the studio. They give you all that reminders. Then the fifth one is accountability. They make sure that they take feedback from you and then they work on them in an unbiased manner. These are the 5 simple steps Disney use, and it's working out great for them. I'm on for Edibisi. Thank you so much for watching this video. Remember to share, comment, drop your suggestions in the comment section. You can share this video, but most importantly, make sure you subscribe to this channel and turn on the post notification so that anytime we share a video, you'll be here to catch it. We out.